Once we've diagnosed reflux and we're sure that we're dealing with that entity, then we can talk about treatment. And a lot of people think that we just skip straight to medications, but in fact, most people initially recommend lifestyle changes.
We tell people maybe elevate the head of your bed to help gravity take effect with the symptoms that may be occurring at night. Avoid eating late at night, eat smaller meals, avoid carbonated beverages, and avoid some of those trigger foods that may relax that lower esophageal sphincter and increase the amount of reflux that can occur. If those don't work, many people will go to over-the-counter medications. They may see their primary care doctor or gastroenterologist, and they may prescribe acid-reducing medications.
As people get reflux more often, they start using medications that actually prevent the production of acid. So the stomach content is less acidic, so when they do reflux, it doesn't burn. If you've been on those medications for more than 8 weeks, or you have to take them every day to prevent symptoms, or even if you're having symptoms while you're taking those medications, then it's time to think about surgery.
Reflux disease is normally a problem with the anatomy at the junction of the stomach and the esophagus. And there's usually a hiatal hernia that can accompany reflux disease patients. And when we go and correct that anatomical defect, you can basically help restore that normal anatomy to where patients do not have to take their medications any longer.
So the newer procedure, what we call a transoral fundoplication, tends to provide the treatment without the complications. So if you're taking the medications for a long period of time, if you're symptomatic on those medications, then now might be the time to think about turning towards a surgical procedure that can recreate the anatomy the way it's supposed to work.
Is a minimally invasive procedure that's done without incisions, and it's very helpful in treating the reflux symptoms and as well as decreasing the amount of side effects that was seen previously with the other types of surgery.